My name is Rolande Surpris. I live in the city of Chicago, and I've been coming to the Illinois Eye Institute for about 9-10 years on a regular basis.
My name is Lindsay Six. I'm an associate professor here at ICO, and I work in the Illinois Eye Institute seeing patients, and that's how I met Rolande.
I came here to renew my contact lens. She did my exam and prescribed a contact lens for me, and she gave it to me as a couple of them for trial, and she told me to try them for 2 weeks. When I came back after 2 weeks, she took a look at my eyes again to make sure everything was okay. She saw a different eyesight, and she couldn't understand why things have changed so drastically in 2 weeks. And I have noticed after I left that my eyesight, and I've been wearing glasses, like I said, since I was a teenager, but for maybe 2-3 days, I had perfect eyesight, like I didn't need my glasses. So that was kind of weird. I'm like, oh, okay. And then after 2-3 days, I realized, oh, I need my glasses to drive now.
We sat down with her and I kind of said, is it possible you have had diabetes? We went through kind of some of the other signs of diabetes, and I really urged her to get in touch with her primary care physician because it was kind of unusual to have this shift in her prescription.
I went to see my regular doctor, and that's when they told me that they were going to do a glucose test on me, and they realized that my glucose was very, very high.
When I saw her back for that return visit, she had already seen her primary care physician. She was way on top of it. And she said, Dr. Six, I was diagnosed with type 1 diabetes.
The fact that I'm a type 1, I have to control everything that I eat, how much carb I'm taking in my body, and how much insulin that I need. Everybody thinks it's a big deal, but believe me, it's not, because after a while you get used to it. I think I'm on top of it. And I make sure I get my eyes exam on a regular basis, my foot exam on a regular basis, dental, because all that are affected by blood vessels, which because of your diabetes can be damaged.
And it was just really cool to see her go from having no clue that she had any sort of systemic disease to having it under control within a matter of 4 to 6 weeks, just because she had had this eye exam for her contact lenses. So if we hadn't detected the diabetes when we saw Rolande for her eye exam, it's very possible that her disease could have gone undetected for more and more years. So if she hadn't come to see us for an eye exam, it would have just continued to manifest for her. So I'm glad that we caught it and she was able to get her treatment earlier versus it going undiagnosed and then uncontrolled for longer. And that increases the risk that she could end up with changes to her retina, diabetic retinopathy.
And I always tell everybody, have your eyes checked. And not just that, it's the fact that here they do such a thorough exam. That's what really saved my sight, and also tell me that I was diabetic, because I'm pretty sure if I had gone to any other those, they just check for eyeglasses. I continue to come here because of the care they give, the attention to each patient, which is very important to me, the personal contact that you have with your doctor. Even though usually you have different students that will see you, but before the student comes to you, they already know who you are and what your diagnosis is, what is the issue, what is the problem. So they don't come back here and ask you a bunch of questions that you have to answer over that you already told them, because I've been coming here for many years. I don't have to repeat myself because they already looked at my chart. They know what my issue is, they know what my problem is. I feel that even though I have a new student sometime, I feel like that student know me already. And of course, my doctor's God, we have such a close relationship, especially Dr. Six, because it's a personal relationship. When she see me, she know who I am, how the kids doing, how was the wedding, because I had a daughter that got married, and I ask her about her little ones. That personal thing is so important to me. That's why I will always come back here.